Hey everybody, this is Alec again. What I wanted to talk to you about today was meditation and therapy. This is something that people normally associate more with psychotherapy, the concept of sitting still and trying to meditate in order to help with whatever condition there is. But we found that there happens to be a lot of crossover and that can help a whole lot of people in the physical therapy realm. But it sounds a little bit like voodoo. So what I wanted to talk to you guys about today is what we're trying to do, what we're trying to accomplish when we're asking you to do something like mindfulness meditation. So first off, I want to talk about what mindfulness meditation is. Mindfulness meditation practice really falls into this concept of taking a dedicated point of time in your day to just concentrate and focus on what you are experiencing and what you are feeling. So that does not necessarily mean this actually has almost no relation to any of the more religious types of meditation, like whether it's Buddhist meditation or prayer. This has more to do with just taking a moment to sit still and really focus on what's going on in your body. This sounds a little bit like, okay, but how's that going to help? And that's a very valid question. And that's one that I always like to go over with people. So I want to talk to you guys about it today. Why does it help and what are we doing? So one of the things that we have learned about is that this has a large relationship with what we call the stress cycle in the body. So whenever we undergo a physical or a mental stress, those two can be related. What we find is that the body starts to have a whole lot of different reactions to try and protect us. So our body's not very good at determining whether a stress is truly life or death like a tiger, or whether it is work-related. We have very simple cascades that are all correlated. But what that means is that when we have a stressor applying to us chronically, again, physical stress or mental stress, life or death or work-related, our body does the same thing. It starts to cascade things that kick us into overdrive. So, by taking time to really sit still and take stock of what we're doing, one of the things that we are doing is activating the system that helps down-regulate that stress. We're trying to help activate the system that takes us from maybe fight or flight is a term you've heard, down to rest and digest. Now, these are oversimplified terms that we have. Fight or flight is a generic term we use for the different reflexes that our body has that start to stimulate us in an active situation. When we're stressed, it's part of the gigantic cascade of things that happens to try and protect us. The rest and digest period is something that we use to describe the cascade of things that bring us down from that level. Turns out that there's not just one or two systems. You may have heard back in early school something about the sympathetic and the parasympathetic system. While those two are part of the neurological system that controls what part of our body is active, what part of our brain is active at any given period of time, it's not the only thing, and there's a lot more to it. But it gives us the base concept of we have a part of our body that's trying to take us back into just basic regulation. Breathing well, digesting well, using our nutrients appropriately. It's one of the reasons that people who are in chronic stress have a harder time keeping weight off. And you've probably heard people talk about how that, I just can't lose weight. Sometimes it has nothing to do with the fact that you are not doing the right things when it comes to exercise and diet, but that other stressors in your life are making your body feel like it has to focus on something else. It can't focus on losing weight right now. It can't focus on appropriately using nutrients because it just has to store things for later in terms of make sure I have a lot of energy, and then any energy I have right now I have to use in survival. I can't dedicate it to other things. That makes sense, actually. Our body is built on survival, on finding that homeostasis. If it doesn't feel like it can take time to actually downregulate and go into just normal lifestyle activities, it's not going to. It's going to keep operating way up here, but it means that the things that happen down here aren't going to get as taken care of. And that can be something as simple as taking stock of an area in pain. One of the reasons that we have pain is to try and warn us of a potential injury. We've learned a lot about this over the past few years of pain research. Probably about the last 15 years have been the most exciting in researching on what really causes pain. Because we found that it doesn't necessarily correlate to having a real injury. We can have somebody in massive amounts of pain where it feels like they've shattered their arm, and we cannot find a physical structure causing that damage. That doesn't mean the pain's not real. Your body is experiencing something that's telling us you need to check on this. But until we can really take physical stock out of this, it can continue to cause problems. You may have heard your coach at some point tell you, oh, walk it off. What we're doing when we are actively walking on a sprained ankle is we are testing, all right, how much force am I actually able to apply here that isn't dangerous? If I apply a little bit, okay, that wasn't so bad. I can do a little bit more. And progressively over time, our pain seems to go away very quickly. And all we did was try walking. Why is that? Well, our nervous system was taking stock over, all right, I think I've injured this. If I put a little bit of weight down, all right, no. Put a little bit more weight. Okay, that's fine. And it's building up an understanding of, all right, what's truly happening in this region as we take into account some of the other nerves in the area. Nociception is a very complicated thing, but all it is suspect of potential damage or potentially noxious, something that could be wrong. We also need to attune our proprioceptors in the region and say, all right, where am I in space? Our pressure sensors, all of the different nerve endings that sense a variety of things in the area to test, is this okay? Are my mechanoreceptors receiving something that is normal, or is this really actually off? You'll find that some people cannot walk off an injury. This is our body's way of saying, hey, no, something really does seem to be wrong here. Now, it's not always correct. Our body can't actually test whether or not a bone is broken just by hurting. That's the reason we have x-rays. We have a lot of people who go in and they have all the signs of, wow, they appear to have a broken bone. But then we do our best imaging and no. Well, that's interesting. But then what can we do about it? Things like mindfulness meditation can really help people who've been in chronic pain, especially when we can't find something that is the direct causative factor. And this is a fair amount of patients who've been told there doesn't seem to be something physically wrong. Your pain is real, but we don't know why. What we have found is people who then take time to decrease the level their body experiences about stress, because pain itself is stress. We're experiencing this chronically, we've created a chronic stressor, and we're not giving ourselves the time to deal with it because we really need to fix it. Well, sometimes that fix is simply paying attention, taking a little bit of time to help your body down-regulate. And by really monitoring what we are experiencing, by being very mindful of what we're experiencing, sometimes we can help our body understand, okay, this is really what's going on. Just like walking it off, but being a little bit more directive over maybe a general area of pain or something that just doesn't seem to make sense. Taking the time to take stock of our body's perception and truly experience it and try to help the brain understand what's going on is the point of mindfulness meditation, and it's one of the reasons it can be very effective for people with chronic pain, because often chronic pain is not related to just one structure. This is, again, one of the mistakes that we've made in medicine, is to feel that, okay, if you have pain, there's one structure causing it, and only one structure, and if we fix that, it'll solve everything. And we've noticed a lot in the past that when we've tried to fix the structure, it hasn't solved the pain. Well, seems to be another piece of the puzzle. Number one, sometimes it's not just one structure. But number two, sometimes we also need to take into account that if pain has been present for a little bit of time, sometimes a few days, sometimes a few months, sometimes a few years, our body system has not gotten a chance to truly inspect and understand what's going on. And often it's not just one session of paying attention to your body that helps. We need to be mindful about what we're feeling through a variety of things. And when we're doing exercises here in the gym, you'll often notice asking you, all right, how did that feel? Is that enough? Is that too much? Trying to get people to actively pay attention, using this base concept of mindfulness to transition into our exercise routine so that people can have a better effect out of their exercise. It's one of the reasons that we feel we have our good effects here in physical therapy, is that we can take this time to really actively feel, what am I feeling? And that is the base concept of mindfulness meditation to begin with. What am I experiencing right now? And if we can use that to complement our physical therapy, it's great. Thanks, guys, for tuning in. We'll see you again next time.